Okay. All right, and so we're going to talk about blood pressure today. Okay. Now, when it comes to medicine, there are three types of medical problems, broadly speaking. So the first type is where patient thinks the problem is important and doctor thinks the problem is important, and that's great because then both people are on the same wavelength. Both people want to sort the problem out. Second type of problem is where patient thinks that they've got a problem, but medics don't really care because it's not like a big medical issue. There's no real morbidity, or rather, there's no mortality, but there's a bit of morbidity, which is why the patients care. And then the third type of problem is ones where we care a lot because we know that down the line there's going to be a lot of mortality issues and even morbidity issues, but the patient doesn't care anything about it, and that's because at this point in time they've got no symptoms. Blood pressure is a good one to use as an example of this because when most people find out they've got a blood pressure, it's just because they've been for some sort of routine examination or health check and you find that their blood pressure is high. Okay? So now, in that situation, I need to convince my patient that I want them to take the medication like I'm asking them to. As far as they're concerned, they've got no symptoms, so then why should they bother? Now, the reason why these problems are difficult is because, on the one hand, they've got no symptoms. I give them medication, and also they might now get symptoms. So, therefore, what's in it for them to take the medication? We may as well talk a little bit about management of change then in this situation. So if we look at corporate management of change, okay, we can use some of the theories that they've devised and apply them to medicine. So when it comes to change management in a corporate scenario, there are certain factors which resist change. So the first one is that the patient, in that case, the people involved in the change scenario, are not really keen on having a change. And the reason for that is because they don't necessarily understand what the new scenario is going to be. And the main issue behind that is that if they don't know what the new scenario is going to be or what the new work environment is going to be, then number one, they might not have, they will be worried about whether or not they have the right skills in that situation. Second issue is that if they don't have the right skills, then that in turn can lead to a loss in either face or position. And that in turn can lead to a loss in finance, and that tends to worry people quite a bit. Okay, so in order to overcome these problems in change, you need to clearly articulate what the new situation is going to be. On top of clearly articulating what the new situation is going to be, you explain to them what their role is going to be. And then once you've explained what their role is going to be, you explain that you'll give them enough support in order to help them through so that they can manage what their new role is going to be. So you will make sure that they have enough resources and that they'll have enough training to be able to perform in their new role. Now, when you go through this change process, the first thing you have to do with these people is you have to explain to them why it can't stay the same. And then the final thing that you have to explain is what's in it for them. Okay, those two things normally go together. Okay, so let's take that and apply that now to blood pressure. So you want to explain to the patient why it is that you need to treat their blood pressure, i.e. why it can't stay the same, i.e. they're not going to have any treatment. Okay, so with blood pressure, then you know the reason we're treating blood pressure is because we're looking at their risk of heart attacks or strokes. So in order to give the patient an idea about why things can't stay the same, there's a rule of thumb which says for the systolic blood pressure, every 10 millimeters of mercury that you drop the blood pressure by, you halve the chance of them having a stroke or a heart attack. For the diastolic blood pressure, for every 5 millimeters you drop their blood pressure by, again, you halve the chance of them having a stroke or a heart attack. So let's say, for example, and the treatment ranges that you're looking for is 155 for non-diabetics as a systolic and 85 for non-diabetics as a systolic. So let's say, for example, you've got someone who's got a systolic of 150, so that's okay. But you've got a diastolic of, say, 100. So you say, well, look, we want that less than 85. So that's 15. That's 3 halvings of your risk of having a heart attack or a stroke. So we'll halve it once, we'll halve it again, and then we'll halve it a third time. Just think how good that's going to be. Okay? So now you've got the patient motivated to a degree. And then what you do is you explain what it is that they're going to have to do and what it is that we're going to do. So you can say to them, so the things that I would like you to do is exercise and diet. Talk about lowering their salt content and having an overall healthy diet. And then exercise. So the exercise needs to be roughly half an hour, 3 times a week, okay? and the half an hour that I want them to have is such that if they were walking, for example, they were walking with somebody, then they need to be walking at a rate such that if they're having a conversation with someone walking next to them, they're just about able to have a conversation like that. Okay, so they're a bit breathless, but they're not panting away, and they're not also having an easy conversation like we're having now. Okay, the beauty of that particular way of monitoring their exercise is that the amount of exercise they have will then increase, or the intensity of the exercise they have will increase in proportion to as their fitness goes up. So as they get fitter, they'll have to do more to get the same sort of level of shortness of breath. Okay. Now then, treatment-wise, normally I explain to them that if they were able to do that at half an hour, 3 times a week, then that normally drops their blood pressure by the starting rate of medication that we would give them. Okay. Then what I normally do is I normally explain their blood pressure in terms of a central heating system. So you say, imagine your central heating system at home. You've got a pump, and then you've got a system of closed pipes, and in those closed pipes you can let some of the water out through the radiator taps. Okay, so there's only 3 ways you can change the pressure within that system. You can either get rid of some of the water, open up the taps, get rid of some of the water, same size pipes, less amount of water, then you're, thank you, same size pipes, less amount of water, then you've got lower pressure. Or I can increase the size of the pipes, same amount of water, bigger pipes, again, lower pressure. Or you can decrease the force with which the pump is pumping, okay? And again, you'll end up decreasing the pressure. Now, depending on what I'm giving them, usually it's going to be an ACE inhibitor. You normally say that this works in 2 ways. It increases the size of your pipes and it gets rid of some of your water. And there's a downside, it can affect your kidneys, so we need to do blood pressure, we need to do a blood test in 2 weeks' time just to make sure your kidneys are working okay. Okay, so that system that we've talked about with regards to the central heating system and blood pressure, you can use that yourself as well when it comes to rationalising treatments that you can use. So if you've already given a patient something which has decreased the amount of fluid they've used, so like an ACE inhibitor, and it's increased the size of the pipe, then maybe the next time you want to give something that's more going to affect the heart. Okay, so something that will decrease the force of contractility of the heart. Okay, there are standard algorithms now that NICE uses. Okay, and the next one to use, so once you've given them an ACE inhibitor, the next thing you're going to use isn't going to be a beta blocker. Okay, it would be a calcium channel blocker. But it's a good way of thinking about how it is, how what you're giving them are interacting, and when you get into difficulties, what it is that you might want to give next. Now, as a GP, that's fairly easy. Once they're on 3 medication for the blood pressure, then it's a referral that then is required. If you're in a hospital, then that's a separate issue now. Okay, so that's blood pressure, how I explain it to patients in a nutshell. So just to quickly recap that then. So we've talked about change management. So we've talked about how there's 3 different types of patient conditions that patients can have. One's where the patients don't care about it, but we do. Second, where we care about it, patients care about it. Things like heart attacks, major operation, hernia operations, major trauma. And then things that the patients, I forget which one we've given you already, but let's say the ones where the patient's not worried about it, but we are. Okay, blood pressure is a good example of that last one. We've talked about management of change, and we've talked about what the barriers are to change management and how that might apply to medicine. So normally I explain to them why things can't stay the same. If we don't do anything with your blood pressure, increases the chance of you having a heart attack or a stroke. And then we talk about how that in turn, what they can do to help drop their blood pressure and what we're going to do for them. And then we talk in turn. We've talked a bit about the central heating system model and about how using that system, there's only 3 ways you drop the blood pressure: decrease the amount of fluid in the pipes, increase the size of the pipes, decrease the force of contractility of the pipes. Okay? Bye then.